Hi, my name's Manoj Krishna, and today I want to tell you a story about a 77-year-old lady who had a spinal fusion for back pain. And it illustrates how older patients also get the same outcome as younger patients, and age on its own is not a barrier to safe or successful surgery. Patricia had had pain for 13 years. She'd had a previous fusion at L3-4, and she had wear and tear in the L4-5 and L5-S1 discs as seen on the scan here. The x-rays showed that she'd had a metal spacer put in the L3-4 disc from the previous operation. And this is a view from the front where you can see the spacers in the L3-4 disc. Her pain was quite intrusive, and initially we tried physiotherapy and an epidural injection, as can be seen here, which seemed to provide short-term relief. But then the pain recurred, and she was keen to proceed with surgery. So I did a posterior lumbar interbody fusion at L4-5 and L5-S1 with a dynamic stabilizer at L3-4. We took out the discs, the bottom two discs, and replaced them with cages filled with bone. The surgery took about 3 hours, and she was in hospital about 4 days. Here's Patricia telling her own story.
Afternoon, Patricia.
Good afternoon, Mr. Krishna.
So, I'm sorry to ask this, but how old are you?
I am 77.
77.
Yes,
Golly,
yes.
that's okay. You look very good for 77.
Flattery will get you everywhere.
It does. It does. Okay, so please tell me a story about your back. So in 2005, I think you had your first back operation.
I did, yes. Yes.
When they found some stenosis at L3-4 and they did a decompression and stabilization.
That's it, yes, yes.
And you took time to recover from that.
Yes, it was a difficult time because you are either flat on your back for 6 weeks or upright. You can't sit.
You weren't allowed to sit at the time.
Not at all.
Yeah.
And unfortunately, mine went on for more than 8 weeks.
Okay. But you seemed to recover overall from that.
Yes, I did. Yes, I did.
And then gradually, of course, the pain got worse again.
Yes. Yes, after a couple of 2 or 3 years, maybe a few more. Yes,
And then
and
it
it got very bad then.
Okay. And what were the symptoms you had when you first came to see me?
I had lower back pain. I found great difficulty in bending, uncomfortable sitting, extreme difficulty going up and down stairs, and a lot of standing pain, so that I could only stand for really a few minutes before I needed to sit down and recharge the batteries, as it were.
And your right leg was weak and painful as well.
Yes, it was. Yes.
And you were, of course, on regular painkillers.
Yes, which became increasingly non-effective.
Okay. And you tried a lot of physiotherapy.
Yes.
And it wasn't helping.
No.
Okay.
And in the end, the physiotherapist said to me, I really can't do any more for you. I think you need to see somebody special.
Okay. So you came to see me, and I think we tried the non-surgical options, but we ran out.
Yes.
And they weren't effective. So we operated.
Yes.
About a year ago.
Yes.
And we did a 2-level fusion, quite major surgery for someone,
Of my age.
Yeah, at 76. So talk me through the surgery and your recovery.
Well, the surgery, I don't remember anything about at all. It was just, I just had a nice little injection, and I went to sleep and there were smiling faces all around me as I drifted off. And when I came round, I wasn't too uncomfortable at all, very sleepy, and slowly but surely recovered, became more and more comfortable. Any pain I had was supervised by the nurses at the hospital, and it was not an unpleasant experience at all.
Yeah, and you were in hospital for how long?
Well, I had the surgery on the Monday, and I came home on the Friday.
Okay. And I think your wound took a little while to heal.
My wound did, yes.
But it did eventually.
It did eventually,
It did.
yes. And it was only a very small problem. It just leaked.
Yeah, it just leaked away. And
Yes.
it wasn't infected, it was just leaking, and
Yes.
in the end it all dried up.
Yes,
It was fine.
yes, it did, yes.
Okay, so you're a year from surgery, and tell me how you are now, please.
Absolutely wonderful. I can do things that I haven't done for ages. I was kneeling down to do some cleaning the other day, and it suddenly dawned on me that I was actually kneeling on the right knee, and I haven't been able to do that for a long, long time.
Okay.
I can garden, which is again hands and knees work. I was raking up leaves the other day without any discomfort whatsoever. So, I am better than I have been for years.
Okay.
And more mobile than I have been for years.
Even before the first operation?
Yes.
Yes.
Definitely.
Because your spine is more stable now. We put
Yes.
screws and rods
Yes.
in and so
It
on.
is. But also, I do feel that I'm more supple, despite the fact of having screws and rods in.
Yes, yes. We'll check your range of movement in a second. But how much back pain do you have?
None at all.
No, that's quite astonishing, isn't it?
Yes.
Considering you've had a previous operation.
Yes.
And you're
None at
77.
all.
And your leg pain, I think you've got a bit of foot.
I've got a foot problem.
Your right foot feels a bit cold.
Very cold and peculiar, almost as if the toes are held onto the foot by elastic bands. It's
Yeah,
very
I
odd.
think it's a nerve that's being
Yes, I
irritated.
think it is.
But otherwise, you've not on any painkillers or
No,
anything.
no.
So let's have a look at your range of movement, please. Let's
Okay.
see what you can do in terms of bending forward. Wow, you can touch your toes.
Yes.
Wow, okay. Yeah, that's fine.
Do you want me to go sideways?
Okay, go on then. Yeah, and the other way. Yeah, and backwards. Just turn to your side and then, yeah, and go backwards. Yeah,
Now that I can't go very far.
but you're still far enough.
Okay.
Okay, thank you very much.
You're welcome.